Buenos días, buenas tardes o buenas noches, dependiendo de dónde estemos. Llegamos a la jornada final, a la última sesión de el Foro de Salud Digital Recainsa 2021 y cerraremos con una conferencia magistral que yo en lo personal he estado esperando toda la semana para llegar a esta conferencia. Agradecemos a Karen Callender haber aceptado nuestra invitación a participar. Realmente nos sentimos muy honrados con su participación, teniendo una de las mujeres líderes en salud digital a nivel mundial. Así que, sin más preámbulo, muchas gracias, Karen, nuevamente, y el espacio es tuyo.
Sorry, I'm just trying. I need to fill out a password. If you just give me a minute. Zoom is asking me for a password. Let me just see how I can.
No worries.
I haven't had this pop up before. It's to share sound. It asks me for a administrative password. Hopefully that would work. And I hope you can see my slides in full screen.
I think that we are watching in the, well, I don't remember the name of the mode of reproduction.
Is that better?
There you go. Thank you very much.
Wonderful. Excellent. And thank you everyone for staying on after a packed week of sessions. Come to the closing keynote, and I'm very honored to have been asked to present today on digital public goods and how we can use these as an opportunity to make digital health more inclusive. My name is Karen Callender, and I'm a senior health advisor in UNICEF. I'm talking now from sunny New York, and I also work here as a chief of the Digital Health and Information Systems unit. So without further ado, I'll hop into the agenda for today. I wanted to talk a little bit about why we promote heavily the use of digital public goods. I'll also go into more detail on what we are talking about when we say digital public goods, how we define them, what we mean by open source, the Digital Public Good Alliance that is supporting digital public goods. I will go into an example of a digital public good deployment that has happened quite recently in Jamaica, and also end with a call to action. So just starting off with why we're investing so much in digital public goods. And we know there's no doubt that digital solutions play a critical role in responding to some of the world's greatest challenges. And for example, we've seen technology playing a crucial role in, for example, improved vaccine delivery management when complemented by strong digital systems. We've also seen powering algorithm with enriched data to better respond and adapt to climate change concerns, as well as many new areas related to flattening the COVID curve and new solutions around quarantining and e-learning for students and so on. And these messages are being emphasized also by the top leaders like this one, like the UN Secretary General, who's pointing out the importance of the use of digital technologies, but also the importance of international cooperation to be able to achieve success. But historically, we do know that digital transformations have not been holistic and sustainable in many countries. And in many cases, we see a huge amount of fragmentation and deployments that favor already wealthy nations. So while technology adoption is increasing in low and middle income countries, the control over the technology is still quite centralized and locking countries into expensive and fragmented solutions. But the good news is that digital public goods can actually change this. So historic development of digital approaches has led to an intervention focus and a siloed use of applications. And as a result, this fragmentation occurs. And why is fragmentation so bad? So we look often at 6 sort of main harms that fragmentation can lead to. And the first one being that fragmentation can lead to poor data utility, which leads to inconsistent and ill-informed planning and misallocation of resources, which in itself can lead to poor targeting of very scarce resources and resulting in underperformance at the service level. And it can also lead to increased burden on frontline workers who are already heavily burdened by service delivery challenges and reporting efforts. And leading, so this in itself, then fragmentation can lead to inefficient and ineffective service delivery, as well as inability to address performance challenges and overlapping and inconsistent trainings. A third harm that we see is the constrained innovation and duplication of investments. Number 4 is the high cost, both in the short term, but also in the long term. The fragmentation lead to short-term waste due to cost of development and maintenance of parallel systems that often do the same thing, as well as long-term waste due to the difficult of legacy integration and of existing and unplanned systems. We often see a lack of scale, and this leads to shortages in support for the platforms that do exist and having sort of enough investments to ensure that they go to national scale. And finally, the major risk of fragmentation is that it reduces the impact and results for the population and for the health benefits. Now, why do we say digital public goods can address these harms? So it basically goes across these 4 areas to ensure that digital foundations are scalable and sustainable, sovereign, market stimulating, and safeguarding human rights. And digital public goods ensures that these digital foundations are sustainable and scalable because they encourage and foster capacity building. They can adapt it to the needs of the countries through an ease of adaptability and customization. They facilitate interoperability, and arguably they can also reduce the cost of the health systems. And when it comes to digital sovereignty, it's because they allow countries to see what's under the hood of the platform. It avoids vendor lock-in. And as digital services become more central to government functions, the cost of locking becomes much more high. So the sovereignty is enabled by ensuring countries are the owners of the digital solution that they are deploying. And for the market stimulating, it's because DPGs, digital public goods, encourage growth of local systems. And this is including the implementers, as well as local vendors who can support and develop businesses around them. And finally, DPGs also safeguard human rights. And this is because through the transparency and by implementing best practices in relation to privacy and data security. Now, some other advantages of using DPGs involve the fact that many developers contribute to a digital public good. And therefore, this vendor lock-in that I mentioned, a situation in which customers are unable to switch developers without a substantial cost can in fact be avoided. The source code is freely available and modifiable, so there are many opportunities for collaboration across organizations and cross-sectoral program areas. Also, the cost of new feature development and software maintenance is shared across users and supporters of the DPGs. So resources can focus more on adaptation and implementation than product development. And finally, software development best practices in requirement gathering and user acceptance testing have already been undertaken. And so for countries who deploy the solution, resources again can be focused elsewhere where they are more needed. And the best part of all of this is that digital public goods actually work pretty well. And there is some evidence to show this through, I'm just putting 4 examples here on the slide, that, for example, while the rates of Microsoft charges to government are not there. The rates are not publicly available, but the business consumer price of Microsoft 365, for example, it jumped by 59% at the end of 2015. And as an example, the Australian government spending on Microsoft desktop licenses jumped by 33% in 2016. And this is a significant jump from previous years, according to the IT News, who reported on this. So in 2016, the US government passed a new law called the Megabyte Act, which aims to streamline software license spending with a projected saving for up to $181 million per year. And this is for a single internal agency. And in August the same year, they issued a new federal software policy that aims to improve efficiency, transparency, innovation across governments by promoting the use of open source technologies. And we also see now this taken up by many countries. And we have in the GitHub over 55 countries and more than 800 federal and local government agencies now have their own GitHub profiles where they can gain access to talent to help with improving the solutions and source codes. So when we talk about DPGs, what is it that we're talking about exactly? So I'll first unpack the word. So we obviously have digital, which are the digital technologies, the electronic tools, the systems, the devices, and the resources that generate, store, and process data. And we have the public goods, which are the commodities or services that benefit society as a whole. Now, I just wanted to quickly show a snippet of a video by TechChange that define the global good and digital public good definition in an animation. So I hope that the sound will now play when I start this video.
Digital health global goods are adaptable software and services that address health system challenges. What makes a software a strong global good? Use in multiple countries to address multiple health system challenges with funding from multiple sources. Support from active communities that provide help when needed. Attention to privacy and security best practices. Free and open source licensing with publicly available code and documentation to support affordable customization, all making it easy to deploy at scale. Global goods are used to cut down on unnecessary spending and provide sustainable software solutions for countries, thereby saving more lives and improving the health of humans all over the world. The WHO classification framework in the Digital Implementation Investment Guide has identified 39 potential health system challenges and over 80 specific ways that digital tools can improve health services. These interventions are parceled in a variety of digital health global goods.
Okay, that was the very short video.
Digital health global.
I want to play that again. So that was, if you're interested in looking at these TechChange videos, there's actually a really nice YouTube channel that then goes into describing a number of digital public goods. I didn't want to go through the whole video. It describes, there's videos on OpenMRS, on Community Health Toolkit, etc., OpenLMIS. But if you are interested to see more of these videos, just search for global goods on YouTube and you'll find them. So back to how we got to the sort of the UN backing of the digital public goods. And overall, the idea of digital public goods is not new, and but it has been a growing focus over years on the idea that DPGs are largely driven by a recognition that the process of digital transformation needs effective, adaptable, open tools. And in 2019, there was a high-level panel on digital cooperation organized by the UN Secretary General, in which it was recognized that the potential of digital public goods is there to reduce fragmentation and duplication, and that all actors, including member states, the United Nations systems, the private sector, other stakeholders should all promote open source. And especially those that adhere to privacy and other applicable international and domestic laws and standards. And this recommendation in the roadmap for digital cooperation actually led to the establishment of what is today the Digital Public Goods Alliance, which I'll be talking more about in a minute. The definition of a digital public good came from this UN Secretary General's 2020 roadmap for digital cooperation. And this definition states that digital public goods are open source software, open data, open AI models, open standards, and open content that all adhere to privacy and other applicable laws and best practices. They do no harm, and they help attain the Sustainable Development Goals. The DPG standard, which in itself is an open standard, so that means the community can actually comment and suggest revision to the standards and suggest if new indicators, if they feel that these are not the most appropriate ones. It's published also in the GitHub. But it's a set of 9 indicators that create a baseline of requirements that must be met in order to earn recognition as a digital public good. And solutions have to enable open innovation, and that means that using an open licenses, but also having good documentation around the product, and that data is accessible, and a commitment to standards, best practices, privacy, security, and other components of doing no harm. And if you want to read more about these standards, I've posted a link which you can go to read more. And at the heart of a digital public good, there are 3 components, and they are that they advance the Sustainable Development Goals, that they do no harm, and that open source. And I want to pull out the open source terminology here, because it's a term that is getting thrown around a lot, but not everyone is familiar with this term. So I want to maybe take a second to define it a little bit more. Open is in our definition quite a lot. So let's see what it means and why it's so critical to a DPG. So I want to, so open source software is basically something that anyone can use, study, change, and distribute, depending on its licensing provisions. And I wanted to make an analogy to a bread baker. So imagine proprietary software, like having a bread recipe where you bake bread for your friends and then you give them a loaf. But open source is sharing your bread, but it's also sharing the recipe. So now that your friends have the recipe for your bread, they can work with you to produce more of it, or even improve it, and increase the number of people that are exposed to your bread creations. And sharing the recipe also means that you and your friends can bake together and strengthen your relationships, inspiring others to do so. And finally, you now possess sort of a common language for your collaboration around bread baking. And it's also important to note that not all open source solutions are digital public goods, but all DPGs must be open source. There are, of course, some disadvantages to using open source solutions. And most advantages outweigh the risks. And we know that, for example, using open source code is especially beneficial if a project is going to scale, or if there's a need to transfer the digital technology to the government. With open source, for example, governments can directly copy or customize pre-existing code and set up their own on the servers without having to pay license fees or user fees or costs for distributing the software. However, there are some risks that should be acknowledged before going into this option, and that should be considered. And firstly, that means there's typically no support other from the open source solution community to support there's no warranty for these solutions. So all the support needs to come from the communities that have been set up around the products. There's also no service level agreement that guarantee that defined services are delivered. And so IT administrators must keep a very close eye on the activities going on in the open source community in order to know when to download a new version, when to test and implement important updates or patches. And these processes can sometimes require large efforts and are often requiring quite expert knowledge in these systems. But many IT departments, especially in low and middle income countries, may not have that manpower or expertise to entirely sort of monitor and update the systems locally. Now, also, not all digital public goods are mature and have sort of a large community around them to support the roadmap and the documentation. So the Digital Square community have developed a really great global good maturity model, which basically takes the digital public goods and assesses them based on a number of criteria on how mature they are and how ready they are for scaling. And they are classifying them across 3 categories, including software maturity, global utility, and community support. And of course, the more mature they are, the more support there will be to help scaling them in different contexts. And this maturity framework is tracked over time so that one can sort of see how different solutions have improved over time and where improvements have been made to make these DPGs reach more mature levels. And again, I've pasted a link here for those who are interested to go and see that framework and what it is measuring across different digital solutions. Now, I wanted to spend a little bit of time to talk about the Digital Public Goods Alliance. As I mentioned earlier, the recommendation in the UN Secretary General Roadmap for Digital Cooperation led to the establishment of what we call the DPGA. And this is a multi-stakeholder initiative that was launched in 2019 to accelerate attainment in the Sustainable Development Goals in low and middle income countries by facilitating discovery, development, and use of investments for DPGs. And the Digital Public Goods Alliance is governed by an interim strategy group consisting of the government of Sierra Leone, government of Norway, iSpirit, and UNICEF. And UNICEF is, together with NORAD, the Norwegian Ministry of Health, are co-hosting the Digital Public Goods Alliance. And there are other members involved in the DPGA, which includes the BMZ, GitHub, the Office of the Secretary General Envoy on Technology, UNDP, and the UN Global Pulse. And why do we need the DPGA? So the need for quality DPGs that are accessible, open licensed, adaptable, and quickly deployable is greater than it has ever been. However, the transformative potential of DPGs cannot fully be or equitably be realized unless we have a better transformation of the complex system structures and practices in which those DPGs are embedded. So if we can agree that all countries, and in particular low and middle income countries, need digital technologies to attain their sustainable development goals, there needs to be a better prioritization of digital transformations to improve public service delivery and also to encourage private sector innovation. And that's why the DPGA was established. And there are basically 4 strategic objectives that we have to drive the DPGA. And the first is that to make sure that DPGs are discoverable and sustainably managed to support systems. And that the second one is that there is enough institutional support to DPGs. And thirdly, that there is capacity in low and middle income countries to implement and even create their own new DPGs. And finally, that LMICs have a vibrant commercial ecosystem for capacity also, again, to create and adopt digital public goods. So what does that mean? How does the Digital Public Goods Alliance operate to have that, to achieve these goals? So we work in 4 work streams primarily. One is to maintain the DPG definition. I mentioned that there's a standard with 9 indicators, etc. As I mentioned, it's an open definition. So there are often edits and suggestions made to how to improve this definition, and also measure solutions against DPG standards to review and discover new DPGs. This is linked to the second work stream, which is to maintain a DPG registry. And this, again, is to increase this discoverability of relevant DPGs. The third work stream is to convene expert communities of practice in priority areas, which further highlight high potential DPGs. And finally, there are pathfinding pilots within a number of low and middle income countries to pilot new solutions or existing solutions in new contexts and share lessons learned. And just to maybe dig into a bit more the communities of practice and the work that they do. These are groups of technology and international development experts who convene regularly to support the discovery, assessment, and advancement of the high potential digital public goods within a specific priority area. And just to give examples, DPGA has convened 6 communities of practice across different sustainable development goals. So one is on early grade reading, one is on financial inclusion, we have a climate change adaptation, we have on health, there are 2. We just earlier this year finished one, and I'm co-chairing the community of practice for health. So we finalized a report which looked at new and existing DPGs specifically for immunization delivery management, which we saw was a huge priority in terms of, especially in relation to the COVID vaccine deployment. And through this report, we were able to both vet some of the existing digital global goods that are being utilized, but also some new solutions and systems that were promising and that sort of satisfied the definition of DPGs and that were therefore recommended for immunization delivery management. We are about to set up a new community of practice around telemedicine, telehealth, and virtual health. And there is also other communities being in process. And if you are interested, especially I would say in telemedicine, and this is an area that you're passionate about, we do invite people to reach out to us to express their interest in joining these communities of practice to help finalize these reports. And how does one become a digital public good? So there is a 3-step process whereby first you have to be nominated, and projects are generally nominated by their product owners or someone with a good familiarity of the product, who then nominate this project in the DPG. There's a nomination link on the DPGA website. Then there will be a technical review of the nominees, and they will be reviewed against the DPG standard, the 9 indicators, and that each break down into a number of questions that will be asked to the vendors to understand the openness, the interoperability, and adaptability of the solution. And finally, they will be recognized, if they pass this review, they will be recognized as a DPG on the DPG registry, which is a tool for understanding which solutions are DPGs. And again, you can see this registry using this link that I've pasted below. At the moment, there are almost 650 nominated DPGs in this registry. Most of them, as you can see, is in this green box, which is the Sustainable Development Goal 3, which is around good health and well-being. We have 214 nominees there. And out of all these, there are 71 of these that have been reviewed and gone through technical review and have been vetted to be digital public goods. But again, the review process is, we have a lot of nominees to work through. So it doesn't mean that the rest are not digital public goods. It just means that this is how far the technical review process has gone. Now, I wanted to spend a few minutes just talking about shifting gears a bit and discussing an experience for how using two digital public good platforms could really help scaling a solution at national level, specifically for the COVID-19 vaccine deployment. And I'm focusing here on successes and lessons learned in Jamaica. And just some background is that UNICEF is, on behalf of the COVAX Global Facility, we're leading the vaccine procurement and supply operation to ensure equitable access to the COVID vaccine. And in March this year, Jamaica received its first shipment of the COVAX procured vaccines during a time when there were record numbers of COVID spiking in the country. Hospitals were near capacity and all the schools were closed. So we had to act quickly, and UNICEF, in partnership with the government, as well as a private initiative, the Private Sector Vaccine Initiative, we set up a collaboration to support the introduction of a digital platform to support the distribution and the delivery of the COVID vaccine. And this was a record speed journey, which from basically starting from scratch to having a national deployment, I don't think I've ever seen anything happening so quickly. Jamaica is a small country, but still, what made this possible was that we looked through the existing digital public good catalog to see which solutions and which vendors were ready to deploy today, who had an open source platform which was secure and adjustable, but also pre-designed for national vaccine management. And we found that ComCare, which is a platform developed by Dimagi, had in fact already customized one of their modules specifically for COVID vaccine rollout. So we partnered with Dimagi and adapted the ComCare platform to the Jamaican content and integrated it also with the existing solution that was already used for scheduling of patients, so that the scheduling service could be linked to the patient management registry. Of course, the platform was rolled out still after the vaccine had been introduced. So there were over 160,000 paper records that also had to be entered into the digital platform to make sure that all individuals existed in the digital system. And 150 master trainers were trained, and they trained over 1,000 healthcare workers in this platform within just a few weeks. The handover to the government also happened very rapidly. So the actual implementation from start to finish took 2 months. And the ComCare COVID vaccination system was launched on June 14th this year. And there was a 2-week transition period, an official handover to the government of Jamaica. And this system, just to explain a bit what it does, it's mainly built around a client tracking function where health administrators use this on a mobile application or a mobile tool to during each vaccine encounter. So every time a client is vaccinated, they're being entered into this registry. And the data goes straight to a database where there's real-time analytics, which help monitor vaccine delivery and track the vaccination rate, but also missed appointments, losses to follow-up. And it also ensures that critical segments of the population are vaccinated first. We are now in the process of now linking this through an API to another digital public good, which is called DIVOC. And the DIVOC and ComCare will, through this link, be able to generate automatically the digital vaccine certificates, which are in line and following the WHO recommended framework. So just some of the lessons learned from Jamaica is that there were a couple of factors that made this implementation so speedy and so technically required less effort. And one was that the private sector played a prominent role here. But we're still able to work hand in hand with UNICEF and the expertise provided by various people within UNICEF, as well as the government's willingness to lead, to really be in the driver's seat and partner with the private sector and with UNICEF on this project. There were initial dual systems. One was paper-based and one was digital, but through the heavy investment in making sure all the paper-based backlog was entered into the system, we could phase out the paper-based system very rapidly. And now the whole vaccination platform is happening on the digital ComCare system. There was also a heavy investment of training of trainers, and especially for considering the needs of low-tech staff. And what was also helping here was that the ComCare platform is specifically developed for low-tech staff, sort of, it's very user-friendly, very intuitive. So the actual learning was rather quick for the users. And finally, and maybe most importantly, was that prior donor investments in these two digital public good platforms, the ComCare platform and the DIVOC platform, had already allowed these platform vendors to pre-design and pre-customize COVID-19 specific vaccine solutions. So it took very little effort to do the local adaptation and configuration needed to set it up for the country. So I'm coming towards the end of this talk, and I wanted to finish up with a call to action to anyone who's sort of listening to this, that no matter where you come from, everyone has a role to play in supporting the digital public good ecosystem. Anyone from technology, development agencies, countries, or funders. And what we need to really move the agenda forward is technologists to help incorporate the digital public goods standards into their work and strive to grow the pool of DPGs. And this is anyone from private sector to social enterprises to NGOs, is that as long as everyone apply the standards, we can make sure that the road to becoming a DPG is faster. Development agencies to work with countries to adopt DPGs and use DPGs in their work and consider DPGs for future digital development programs. Countries and government stakeholders can utilize the DPG registry during their procurements and create politics that create a positive bias for DPGs in the policies. And ultimately, the funders are important in the long-term sustainability of the support of DPG's development over time and supporting the implementation efforts. So with that, just a quick slide to show some of the DPGs that are widely used out there. You might recognize a number of them. And then end by saying thank you to all of you for listening. Thank you to the Digital Public Goods Alliance for sharing some of the slides. And we'll open here for questions.
Thank you very much, Karin. I think that has been insightful, especially for the community that works strongly in the production of open innovation, right? So very excited with that. Maybe if the first question, well, we have a question there. I read in Spanish, so it's easier to me. Las modificaciones realizadas al software ComCare están disponibles para la comunidad de software libre. Esa es la pregunta.
Yes, they are. ComCare is one of those digital public good vendors where most of the software development is actually happening at the vendor by Dimagi themselves. And they always make this software and the code available. It's on GitHub, anyone can use it and set it up. But yes, they are part of the global good community, and their adaptations. They have a COVID vaccine module package that they are promoting to countries who are willing to use. And in fact, they're even building on to make sure that whatever is now done for COVID vaccines can also be expanded to EPI programs going forward, so that it doesn't become just a COVID solution, but in fact, a full sort of routine immunization registry.
Thank you very much. Well, in this week, we have a interesting conversation about the open source solution for digital, for health, sorry. And well, the panelists put on the table, you can have sometimes a more or less software, but a strong community. And in other times, you have a very strong software, very good design, but with a weak community. And taking that in consideration, because one of the key and essential pillars of the open source is the community, how are you managing these two options, right?
It's a very good distinction, what you just mentioned, because it's a very clear division between how many of the products appear. Some, as you say, Comcare is probably on the latter side. They have a strong software, but the community around it who develop and improve and build is very much centralized still with a vendor. Whereas if you take DHIS2, for example, it's the opposite to some extent, is that it's very decentralized and much more in the hands of countries or HISPubs, etc., who have taken over the sort of the development and the future adaptations. And I think it's really, it always comes down to not looking at software first, but looking at the business requirement. What are the functions that are needed to solve this particular health service problem, for example? And then once that is defined, that what the system needs to do, what functions it needs to have, then the would be to go and see which providers, which platforms, which solutions can deliver on this. And yes, that's when some of these granularities might be revealing, you know, and maybe if you have two solutions that can possibly both deliver the same product, but one has a wide community and a lot of people who can support, but the other one doesn't, then perhaps that's where the decision is made on which platform should be picked up. Of course, when you have a provider where most of the community, not the community necessarily, but the development and customizations and future developments are sitting centrally, it's not necessarily a bad thing. It's just that the costs will be allocated differently. The costs might be that you need to pay sort of a contract with that vendor, not to own the code, but to receive the services that are needed for the customization and configurations. Whereas the cost of having that done at country level where you have the community, the cost may need to be allocated somewhere else, because there will always be costs. But the question is sort of, who do you pay to get the work done? Is it the platform vendor, or is it partners within the wider community who can support the establishment? Or maybe it's more than geared towards internal capacity building in the IT platforms in the country, where you need to have staff on board who knows how to maintain and support and sustain the systems.
Thank you very much. The last questions in terms of the time. In Latin America, I think that is a very different scenario when you compare with Africa or maybe Southeast Asia, right? Related with or regarding with the open source solution in health. But I think in COVID-19, we have seen a different situation. Before pandemic, a high resistance in the countries to adopt open source solution. But with the COVID-19 pandemic, we gladly see that there are other positions about that. What is your opinion on it?
No, I think you're completely right. I think there has been a new attention to digital public goods through the pandemic. And I think partly because the vendors, the digital public good vendors were quite well prepared. Once the COVID pandemic started, they were quickly able to configure or customize new modules within their existing softwares. And that meant that countries who already used one of these platforms could quite quickly add on the COVID modules. We see this, one of the best examples is again DHIS2, which was already deployed in 60 plus countries. And to add the COVID surveillance module and the COVID vaccine module was not a very big lift. But had it been had the country decided to develop their own solution or gone with a private sector solution that was specifically just for the COVID vaccine distribution, it not only would have cost a lot more, and they might have ended up with long-term contracts that they now can't get out of, but also it wouldn't necessarily fit within the other health systems infrastructures that the data need to flow to. And so I think the appreciation of having digital public goods in place all of a sudden it got a lot of attention because of the visibility of how easy, not easy necessarily, but how flexible these systems can be to be adapted and expanded. And I hope that what we will see going forward is that we'll learn from this experience, and that we can continue to promote the benefits of using global goods solutions, which countries can really own and manage.
Great. To close the session, do you want to let us know about any quote that you have to close the 5 days session?
Wow. I would maybe come back to the UN Secretary General's plea for international cooperation. No one can support this alone. We all need to work hand in hand to strengthen country systems together. And it's only through closer collaboration and closer cooperation that we can overcome fragmentation and really see these systems blossom in a way that is most effective for the people and beneficiaries that they are meant to serve.
Great. We need more human interoperability, right?
So
thank you very much, Karin. We are really grateful with to having you in this closing session, and we hope and we look forward to having other spaces where we can, especially for LATAM, we are participating right in the group of the digital public good, but it's for the Latin American audience, we can have more of these spaces. So thank you very much for your participation. And well, we will pass to the close of the forum. Vamos a pasar, hago el switch al español. Bueno, han sido 5 días intensos, se notan las ojeras, creo. Así que, bueno, qué mejor que cerrar con algunos insights, algunos pensamientos. Y bueno, le dejo entonces el espacio a mi colega, amigo y compañero de mil batallas, con quien iniciamos este sueño de Recaínsa hace 8 años. Así que todo el espacio tuyo, Ale.
Muchísimas gracias, Daniel. Efectivamente quisiéramos tener unas palabras de cierre y primero pues dar los buenos días, las tardes y las noches a todas las personas que nos están mirando, tanto en vivo como en diferido, que sin duda vamos a pasar esto varias veces y va a quedar en algunas plataformas digitales. Y bueno, a anunciar que hemos llegado de manera muy satisfactoria a los últimos días del Foro de Salud Digital Recaínsa 2021 y creo que hablo no solamente por mí, sino por todo el equipo cuando digo que esta jornada nos ha dejado muchas buenas sensaciones. Como lo mencionó Daniel al inicio de este foro, habíamos soñado por varios años en poder realizar un evento muy parecido a este. En aquel entonces no teníamos en nuestra mente que este se coordinaría en medio de una emergencia global como la que nos ha generado la pandemia por el COVID-19, pero aún así estamos cerrando esta jornada con las expectativas, creo que más que cumplidas. Como red, nos hemos comprometido en 3 objetivos estratégicos que ha sido fortalecer la gobernanza en salud, impulsar la creación de capacidades y recursos desde la formación académica y fortalecer los espacios virtuales para el intercambio de experiencias y buenas prácticas. Y con mucha satisfacción hemos podido cumplir en este complejo año 2021 una vez más con todos nuestros objetivos, cerrando con broche de oro con este foro. Con esto, una vez más, nos demostramos a nosotros mismos y a quienes estos años han sido parte de la familia Recaínsa, y no hablo de todos, y hablo de todos nuestros socios estratégicos, que somos fieles a nuestra visión y misión y que estamos comprometidos en ir evolucionando como red en los próximos años, y a lo cual los invitamos a que nos acompañen en este camino. Hemos tenido el privilegio durante esta semana del foro de haber tenido cerca de 2,000 asistentes virtuales. Tuvimos panelistas y especialistas de 3 continentes diferentes, en 20 paneles de discusión y 5 talleres. Esto suma más el alcance que tuvo y tendrá el foro, ya que estamos comprometidos a seguir difundiéndolo en forma diferida. No quiero terminar sin dar unas palabras de agradecimiento a nuestros socios estratégicos y auspiciadores, igual a nuestros patrocinadores, y por todo el soporte que han dado a nuestro foro también. Quiero agradecer a todo el equipo logístico que estuvo en el foro por haber trabajado con las fuerzas y mística como lo hicieron. Desde Recaínsa nos comprometemos a seguir teniendo más ediciones de este foro. Nos comprometemos para que cada año podamos ofrecerles mejores experiencias y recursos que den más valor a sus proyectos y formación, y nos comprometemos a entregarnos con mucho más fuerza y más pasión, y también hacemos propia la visión que impulsa la OPS y la OMS cuando se pregona que nadie se quede atrás. Termino mi intervención recordándoles y persuadiéndoles desde Recaínsa que juntos somos más fuertes. Muchas gracias.